Hi, my name is Tammy, and as of 2012, there had been 22 million people who have been diagnosed with diabetes in the United States. And during 2012, there were over 240,000 deaths that were associated with diabetes or complications from diabetes. This comes from an article in CNN Health from March of 2013. Unfortunately, I am one of the 22 million that has been diagnosed with diabetes, and therefore I have attended 4 classes at the Diabetic Learning Center over the last 14 years, where I have learned most of my knowledge of diabetes, how to give myself insulin shots, and how to test my blood sugar. Testing your blood sugar for a diabetic is one of the most important things that you can do, and you should test it often. This allows you to give information to your doctor that will show how well controlled your diabetes is, which will help them determine how many times a day they want you to test it, or if you just need to test it a couple of times a week, and at what times during the day. Now, for a diabetic who is feeling symptoms of low or high blood sugar, they should test their blood sugar immediately. But other times that the doctor will have you test it is first thing in the morning, which is before you eat, which is called fasting, 2 hours after a meal, or at bedtime. Now, if you are testing your blood sugars because you are feeling symptoms of low or high blood sugar, then you should test it in the finger. There are several places that you can test your blood sugars. However, the finger is the most common, and for those that are feeling symptoms, that's where they should test it. Now, for a diabetic, we have what we call a lance, and it takes a lancet, and it's got a needle at the top. Now, my lance has 2 different tops to it. The solid colored one is the one we use to test in the finger. The clear one is the one we test alternate sites at. Now, I'm going to go ahead and test my finger. For those that are having symptoms, or if they're testing it less than 2 hours before or after a meal, then you need to use your finger. If you're testing it at fasting, first thing in the morning, 2 hours after your meal, or at bedtime, you can use one of the alternate sites, which is your upper arm, your forearm, the base of your thumb, or your thigh. You take a alcohol wipe and you clean the spot where you're going to test your finger. And while that's drying off, what I'll do is I'll take my test strip, and I have my glucose monitor. So I will put my test strip in so it's ready for me when I get my blood droplet. We pull it back and cock the trigger, and then when you do that, the needle goes in, and your strip will pull the blood up for you. And my monitor takes 5 seconds. It gives me a blood sugar reading. Now, my blood sugar reading is 290, which is high. Blood sugars, the range is usually, what they usually like for you to have is at fasting, less than 100 or less, 2 hours after a meal, 130 or less. However, those of us who have diabetes, the target readings are between 70 and 130 at fasting, or first thing in the morning, or under 180 2 hours after a meal. Now, it is very important that you test your blood sugars and you keep your blood sugar under control, because there are many diseases that are associated with diabetes, such as heart disease, kidney disease, eye disease, loss of limb, and even death. And by testing your blood sugars and testing them often and keeping your doctor in the loop on where your diabetes is, if there is a problem, then your doctor can adjust your medications in a timely manner, which can help prevent those diseases from happening because your blood sugar is out of control. So it's very important. Test your blood sugar. Test it often if you're a diabetic. Thank you.